A Florida Surgeon General wants to change the state's COVID testing strategy. This way, he says we can cut down on the long lines we've been seeing at all the test sites. But not everyone agrees with his new guidance. Let's go out to Fox 13's Aaron Mesmer, who's live at the Progress Village testing site. So what's it like out there now, and what is the Surgeon General actually suggesting?
Well, this site, Cynthia, just closed a little bit ago, so the line that had been here has just subsided at this point. But we've heard about lines throughout the testing sites across Tampa Bay that in some cases exceeded an hour. With that in mind, Florida Surgeon General believes the state needs to go to what he called a high-value testing strategy, but some experts worry that this is just going to lead to more people getting sick.
So this is sensible public health.
Florida Surgeon General Dr. Joseph Ladapo announcing a new strategy for COVID-19 testing.
Testing people for a respiratory virus when they have no symptoms on a massive scale is abnormal.
Ladapo believes the state's focus should be on testing only people who are symptomatic. He calls it high-value testing.
What we did before this pandemic is what was normal, which is if you have symptoms, we'll test you. And, you know, if you test positive, we'll treat you.
The new guidance brought strong criticism from some experts, including USF Health Dr. Thomas Unash, who tracks COVID's impact in Florida.
If my 97-year-old mother-in-law gets COVID-19, Dr. Ladapo at this point in time has nothing to offer her in terms of treatment apart from chicken soup.
Dr. Unash says the state's new approach would only work if there's an effective treatment. He says the monoclonal antibody treatments available in Florida don't work on the Omicron variant.
So if you can't promise an effective treatment to people, what is the best way of protecting that at-risk population? Not having them get exposed in the first place.
And he says the best way to do that is to follow the CDC's guidance. The CDC calls for a much wider range of testing. That includes people who are symptomatic or come in contact with a person who tested positive for COVID, and those who employers or schools require them to be tested. The reason?
If you're asymptomatic, you can spread the virus.
But as wait times for testing in Florida stretch on and demand remains high, the governor says he's focused on the high-risk population. On Thursday, he announced the state is sending 1 million at-home testing kits to nursing homes and long-term care facilities.
Those are the demographics that are going to be more likely to take a positive test and then parlay that into treatment.
And those kits that are being sent out to long-term care facilities are part of a stockpile that the state built up over the last year or so, or the last several months, as cases subsided. However, many of them, we're told, are now expired, so the state is asking the federal government to extend that expiration date. And Cynthia, right now, they're still waiting for a response.
We could sure use more tests, that's for sure. Thank you so much, Aaron.